Good afternoon, everybody. Well, listen, the first thing I want to tell you is when Gary called and asked me if I wanted to speak at CleanMed, I just jumped at the opportunity. And then when I realized the error of my ways, I went out and bought some hearing aids so that would never happen again. Gary always has so much enthusiasm that he literally tricks you into doing anything he wants. But luckily, they're the things that you actually want to do. So before I do anything else, I want to congratulate Healthcare Without Harm. I want to congratulate all of the others, the Healthcare Climate Council, the Practice Green Health. All of the folks here have worked so hard and for so long to get people excited about doing things that they never really wanted to do. Cleaning up hospitals, getting rid of toxics, figuring out just how you could be a better neighbor, a better producer of products, a better sponsor of unions and other engagements with staff. All of these things that are so hard to do that we want to do and we never ever can find the time. Folks like Gary and folks like all of you force others to pay attention to the things that really matter to all of us, the things that reflect our true values as human beings. So it is actually pretty exciting to be here, to actually thank you, because I'm excited to be anywhere where you have mums and dads and parents and men and women who actually care about our children and who care about their future and who have embraced their personal obligation to act and our collective moral responsibility to act on our own values and what's in our best interest, which just happens to be the next generation, which just happens to be the young people today who will not let us rest because they want a more equitable, just, and sustainable world, and they're going to demand it of us, and we need to demand it of ourselves. That's what we are here to talk about. You know, climate change is nothing more than modern pollution, and I'm sick and tired of it. We chose fossil fuels when we were Neanderthals, or perhaps just shortly thereafter. We are no longer Neanderthals. We need not rely on something we thought about centuries ago as a path to the future. We're smarter than that. We see now that there are damages that fossil fuels have created, and while it has helped us grow economies, it is time to get cancer-free, carbon-free economies moving forward. That's what the world needs to be about today. Climate change is nothing other than carbon pollution. C-A-H-B-O-N for those in Nashville that don't understand Boston. And we all know that pollution is not an equal opportunity killer. It attacks our kids. It attacks the elderly. It attacks the poor who are most vulnerable to the impacts from pollution. And we have to recognize the inherent inequity of our decision to not quickly look how to shift away from the pollution that is killing so many people across the world today. 16% of premature deaths across the world are the result of exposure to pollution. This is not a minor issue, folks. This is 9 million human beings. That's 3 times as many as die from malaria, TB, and AIDS combined. This is serious business, and a lot of it is kids. 1 in 4 kids under the age of 5 are actually dying because of impacts in the environment on their health and their well-being. That's 1.7 million children under the age of 5. And a new study just came out that said that 4 million kids a year actually develop asthma just as a result of their family living along roadways. Is that fair? Is that equitable? Do we want to actually just look at this and step aside? How can anyone not get engaged, not get excited? Every sister, every brother needs to get engaged and not sit on the sidelines in silence. We have allowed climate change to be a partisan issue. We have allowed it to be about polar bears and glaciers. It's not about that, and it is not a partisan issue. I have worked my entire life in the public sector. I have worked for 6 governors. 5 of them were Republicans. I don't remember any of them wanting to drink dirty water. I don't remember any of them wanting to breathe dirty air or thinking it was just fine for us to shorten the lifespan of our children or to threaten their very future. It cannot be allowed to continue. We have to speak up. We have to get together. We have to talk about climate change. It is not a 4-letter word. It has lots more letters than that. Let's talk about it. Make it a normal conversation. You're out working in your hospitals, and God bless you for doing it, because people aren't thinking about these things. It's not because people are bad. It's because people are people. They need leadership. They need to start thinking about things. They need to connect it with their own lives moving forward. And the great news about today is that we actually have solutions that can buy us considerable time and move us to a healthier, cleaner, more sustainable, and a more just future. We should be embracing those with every fiber of our being. We should be demanding them. We shouldn't be scaring people about the danger coming up as much as saying, you're getting messed up and screwed if you don't get renewable energy because it's better for you. It's cheaper for you, it'll keep your kids healthy, and it's going to provide them a future that you're going to be proud of. What are we arguing about here, folks? Every century has transitions they go through. We have to embrace this one, and we have to grab onto a future that is better for all of us. And the way we do that is by demanding action, by providing leadership, by communicating the threats that we have, and by building hope for the future. Today, the biggest challenge we face is that people are feeling hopeless. They're getting discouraged. Well, if you feel like that, you come up and talk to me for a while, because I will not tolerate it. You may be moping around, but I ain't dead yet, and I ain't gonna give up. I spent the last 8 years of my life in the Obama administration working 24/7 to try to do the right thing. And if you think I think this administration is undoing it, you're dead wrong. We did it right. We followed the science. We made reasonable decisions. We headed the world in a different direction, and that world is still headed in that direction. Go look at who's winning in the energy market. It's clean energy, and it's not coal, and it's never going to be again. That's what we have to protect. And the best thing about this administration, it is totally inept. It has no capacity to do anything but say, this is what I want as an outcome. It can't figure out how to write a rule that the science says that's right, or that the law says that is the choice we should make. And if you can't do that, we have a system in the courts that are going to turn these rules back. So if you think I'm going to spend all my time worrying about Washington, you're dead wrong, because Washington ain't where it's at. It ain't where it's at. Where it's at is in every community that you work in. It's in every community where you speak to individuals about the challenges that they're facing, and you engage them in the issues. You tell them what you know as professionals, as trusted advisors, as people that they respect and they know in every neighborhood. Because nothing ever starts in Washington that hasn't eked its way up from every single family and every single community, through every single state and every single region. And then the federal government gets this brilliant, innovative idea to do the very thing the first community wanted to do 20 years before. So let's get over our worry that with the federal government checking out, that the Paris Agreement is going to have to stall, that we won't be able to make any reductions in climate change pollution, because none of that is actually true. And we will get in the game. You know why? Because young people are going to boot us in the butt if we don't. I am at the Harvard School of Public Health, not just because I love saying I'm at Harvard. Excuse me, Harvard is how I like to say it. I am there because the students are ferocious about these issues. They will not tolerate inequities. They will not tolerate a system of decision-making that doesn't consider the health and well-being of kids in this world. They won't allow us to look backwards as if that's a path to the future. And you know this. That's why you're sitting here. That's why you're doing the work that you are doing, because you care about these issues. I'm here because we share the same values. The Environmental Protection Agency isn't an environmental agency. It is a fundamental public health agency. And if you think you can separate healthcare facilities from public health, you're wrong. Those are connections we have to make together. Because climate is about health. Health is about the environment. We live in one world. It's damn time that we protected it. That's how it has to work. And if we work together, we are going to do this. Now, I am preaching to the choir, but I'm preaching to you for the simple reason that I want to thank you and I want to encourage you to keep speaking up and doing more. Because we are making progress. We do have solutions. We can communicate with people about health benefits. We know right now that over half of the Americans now know that they are already experiencing the impacts of climate change. As President Obama said, we are the first generation to feel the impacts of climate change and the very last to be able to do something about it. So as a country, we need to provide the leadership that America has always provided. We have been the ones that innovated. We have been the ones that followed the science. We have been the ones that knew how to make things happen, and we will do it again. The signs are there. So stop worrying, start acting, keep doing what you're doing. Because I know that people are ready for it across the country. They want safe and healthy climate. They see it as a moral imperative. And 2 in 3 Americans understand that climate action benefits their health. Yes, climate change is the most immediate and significant public health challenge of our time. It's the most immediate and significant economic and national security challenge of our time, but it also happens to be an unbelievable opportunity to ensure that every single dollar that goes into climate change action begins in the communities where health inequities flourish and where health benefits can be the most. That's what we have to do, is look at climate as an opportunity if we look at it through a health lens where we can make people healthy today on our path towards a more sustainable future. And I know that we can trust you to be out there changing the way in which the healthcare sector thinks about this, talks about it, and the way in which our hospitals and medical facilities are run. Because we have to stand up and put our money where our mouth is. We have to stand up and put our money where our years of education have taught us. Not turning our back on science, which is the very fundamental of what got us the jobs in the first place, and let's recognize what we need to do together. You are in the trenches making change. We have to explain to people that a changing climate does not mean that we are going to hell in a handbasket. As my mother would say, it was her favorite saying. Only she used to say, Gina, you're going to hell in a handbasket. And that was when I used to say to her, Mom, what is a handbasket? And then she would say, shut up, and walk away. It was perfect. Nobody in the world knows what a handbasket is. So we really have to just focus on the destination, not the vehicle. And that's what I just sort of figured out. So look, every step we take that tackles climate change is an opportunity for us to do a tremendous job at protecting the people we care about, the ones we love. Of course, it's not polar bears. It's about, for me, Maggie and Daniel and Julie, my 3 adult children, who I look at and can't distinguish between them when they were a month old and them today, because they're still my babies. And I have a new grandson named Dax who is 7 months old. And I will guarantee you that you can come up with your baby pictures all you want. He's the cutest ever. I will fight that fight till the day I die, or until June 21st when my daughter is having a baby. Then there may be a significant competition here. But we have to be that personal with the stories we tell. We can't just give big thoughts. We have to use you as an example of the way in which you've transformed your hospitals to be healthy places to be actually displaying your values, to be reducing the toxics and the carbon emissions that are polluting our world and invading our bodies. You have taught us that there's ways in which we can personalize this in where we work, personalize it in our home, but we have to stop talking about big picture issues that nobody feels like they can get their arms around, because it isn't really about the planet. To me, it's about Dax. To me, it's about that little boy and what I have spent my life fighting for and what I refuse to stop fighting for, which is his future. So we know a carbon-free and cancer-free future begins with clean air, clean water, safer places for us to live and to work and to play. It means fewer asthma attacks, safer places for us to live and work and play. It's basically mosquitoes and tick bites and diseases that won't occur because we've taken care of issues related to climate change. It's more forests to enjoy, parks to play and to stay cool in, right? It's less stress, less anxiety, less fear of losing our homes or our communities or even our lives. It's places that are more resilient to storms and rising seas so we can feel safe and be safe. It's hospitals that survive in an exacerbated weather event and that provide a safe haven for those who need it. Not just hospitals that can turn their lights on, but hospitals that people can get in and out of to get the care they need. This is what we need to provide. We've seen weather events like what happened in Puerto Rico disturb our system of healthcare in New England and elsewhere, as we were flooded in the emergency rooms. And we prepare for bus accidents, we don't prepare for climate events. Start preparing, start thinking about it, integrate it. Once you do, you won't be afraid of it, you'll be ready for it. You'll be spending money to make sure that you can continue to be there when people need you most. So let's imagine that future. Let people understand that it is a future we shouldn't be afraid of or that we need to sacrifice for. We're living in a future we're sacrificing for if we don't take action now. Get people excited, motivate them, tell them the world is at their fingertips if they want to stand up and be counted. Tell them to do what you did, stand up and be counted, get their big boy pants, their big girl pants, and their gender neutral pants on, and move. Thank you very much.
Great. Have a seat.
Thank you. Thank you. Thank you.
Well, thanks so much, Gina, for that inspiring talk. And I just want to pick up on a few themes that you were discussing. You know, at the moment, if you look at the polls, a couple of things are interesting. One is that the biggest issue for people in America around election issues is people are worried about their health care. And the other thing that we've learned is that when you talk about the climate crisis as a health issue, it's the thing that resonates with people the most. Yes. So the question is, these issues have been seen as kind of separate. Healthcare access is totally seen as separate from the climate issue. And how can we change the way we think about it so that addressing the climate crisis is actually seen as preventative medicine?
Yeah, I think we have to be much clearer about the impacts of climate change, don't you? Not in a way that scares people, but that informs them. And really, that's why the voices in this particular room are so important, because, you know, as much as people totally avoid wanting to go to a doctor, you're seen as an incredible, valid person to speak about issues of health. You are a trusted advisor. Nurses even more so. God love nurses.
God love them.
God love nurses. You know, and if we can get into a routine of not making this be a climate event to talk about climate change, but to just be part of the conversation, you know, then I think it will integrate. I know that it motivates. I have never found anything that motivated action more than raising health issues. And that's, you know, what we tend to do is we count the damage to health, and we count the benefits, and we make it, you know, the most reasonable way we can get the maximum benefits for the least cost. And then you run with it. And I think people will get it if we stop making them think that we are saying something that is partisan.
Yes.
When it's not. When we get them to realize that climate change is not a belief system. It's real, it's happening, man-made emissions have caused it, which is why women do need to rule the world.
There's no argument here. This is true in my house already.
And the bright signs, though, Gary, I think, which you would acknowledge, is that the polling is showing distinctly different measures of people's awareness of climate and their need for climate action. You can't have the kind of flooding we had in the Midwest without, you know, farmers taking notice of this. And it's not just weather changes.
And it's not just blue states, red states, it's all states.
No, it's all states. And in fact, you know, the president's base is what's getting hit the most. And so people want action. They may not want to talk about it, but they want to do it.
Let me ask you about that, because how important is it, and we've been engaging healthcare leaders to step up into the policy realm, because we think that the voices of healthcare leaders and hospital systems and nurses and doctors and others is so powerful. How would you, but in some places it's pretty tough, the political environment is pretty tough. What would you say to some folks who say, I'm kind of reluctant to step out and be an advocate in this place? I worry about it being seen as a political issue, a partisan issue. What would your advice?
You know, people have to make their own choices. I mean, if you just go out and talk about what you know, which is health,
yeah,
and make the same case, you know, I learned this when I was doing some work in China and India, and at one point in time, I authorized putting an EPA monitor, air monitor, on the embassy in Beijing, which turned out to be for the Chinese government, turned out to be a very controversial thing. We put it on the embassy because we knew that the results from the air monitoring in Beijing were not showing the full extent of air pollution. And the embassy staff wanted to know what the real numbers were so they could figure out if their kids could go out and play.
Right.
And when we put it on there, some weird thing happened, and it ended up being shared with more than people in the embassy. How that happened, I don't know. But it became a real issue. And China actually changed entirely their thinking about climate change when that happened. Because they realized, in thinking about how to grow their economy, they realized that they could not continue to escalate air pollution in areas where they had really middle-income populations, because it became a threat. Now, so then you look at it, they began to embrace climate, they began to try to think about how to grow their economy differently, and then you go over to India, where I have worked, and the two things in India that are important to look at from a health perspective are primitive cook stoves, which kill, you know, an average of about 4 million women and children every year. That you don't need them, we don't want them, we need to make the shift, but also coal-fired power plants.
Yeah.
And if you look at areas around New Delhi, that's the key issues, but it also just happens to be the thing you need to do for climate change. So if you're concerned about leading with climate, I am not going to be a purist and tell you better use those two words. I am going to tell you that can follow the health discussion. But you should try to integrate it in because as a nonpartisan, factual discussion about science. That's how I would at least encourage it, because that's your forte. You know these issues. And I don't think they're going to challenge you directly on science. They'll challenge you on partisanship. So don't lead with that. Let it follow. This is not a partisan issue.
We've started to put air monitors on hospitals in India and then get the doctors to start messaging around the air pollution and its health impacts and getting it on radio stations. So now they're doing health alerts in the way they would do traffic alerts. So it's sort of leveraging that power. Let me ask you, I mean, this is one of the last times that there was a really big push in the health sector to change the societal addiction, as it were, was around tobacco.
Yeah.
And many people were part of that effort. What do you think are some of the lessons we might take from that effort toward thinking about fossil fuels?
Yeah, we use that comparison a lot. I don't tend to use it too much because it took 40 years between when we knew tobacco killed people and regulating it in any meaningful way.
Yeah.
And there is
we don't have that time.
I don't have that time. No. So we do need to use the lesson that it's bad for you, you can get rid of it. But the challenge with fossil fuels is it's unlike tobacco, which actually served no useful purpose. Fossil fuels did. And so you have to be careful about the comparison. But there's one thing that does connect both very clearly, and that is that tobacco, the playbook that tobacco used to delay for 40 years is exactly the same playbook that the fossil fuel industry is using to delay meaningful action on climate change. And down to the very same people who they hired.
The PR firms.
The scientists
and the
that
scientists,
they had have become the major spokespeople for fossil fuels.
There's a good movie about that called The Merchants of Doubt.
Yes, it was written, the book was written by Naomi Oreskes,
right.
and she's at Harvard, she's a historian, and it's if you want to look at a clip that'll give you the creeps, that's it. Yeah. So the challenge I think we face now is that really the fossil fuel industry, which now is becoming more and more evident, has spent exorbitant amounts of money in political campaigns in support of different political candidates that will, basically provide them the opportunity to continue unabated. And Citizens United became one of the big turning points, I think, in our ability as a democracy to have people speak. And because companies actually aren't people. And so we have real challenges where that comes from. And I think the interesting thing is that, all of the Democratic candidates, let me back up. The interesting thing is in the midterm election, if you ran on a climate campaign, you won in the 2012 election. If you were a young woman who didn't, act like the young women of 150 years ago, and you acted like normal human beings ready to fight, you won. There are changes happening, and right now you see every Democratic candidate has a climate platform. They're all competing with one another, and you are seeing vast changes across the country in terms of people's willingness to embrace both the health and climate message. Polling in Iowa is basically looked at health concerns came second to health care as the major concerns in Iowa, and 95% of Iowans said they supported the Green New Deal. You figure out whether there's change afoot.
Yeah, it's radical. The transformation is accelerating.
It's a really cool period of time, and I think that's don't you think that's sort of American? When the president says something and doesn't do what we think, we just go take it over, and I think that's great.
I think that's great, too.
I think that's great.
Tell us a little bit about this. You've been working with some others, some communications firms, to launch a climate and health communications campaign in the summer or in the fall that could be relevant to everybody in the room, and they could be helpful in that. Could you say a little bit about that?
Yeah, one of the reasons why I'm at the Harvard School of Public Health is not only because I really am a public health person, but because I think it gave me an opportunity to try to work with the students and with the faculty to actually communicate science better. It's always driven me crazy that the big message from the International Panel on Climate Change has been characterized as a probability statistic, which I fully understand. That's how you do science. It's just, other than scientists, nobody knows that. They don't understand you do probabilities and test correlations. And so you say things like, it's very, very likely that climate change is caused by anthropogenic emissions. I'm like, what does that mean? So we have to get better at it. And I think the climate and health message is a motivator. I think it can be stated clearly. I think you can point to on-the-ground challenges that you're seeing. I think you can show what the future would bring if we don't act. And I think you can show solutions that are real and meaningful and cost-effective that we can all embrace and should be demanding. And that's what this is all about. This is about making it a message that's not about polar bears, although polar bears are very cute from far away. Not so cute up close. And I think we can all work together under an umbrella to literally get climate change to run in the next election. I want climate change to be on the ballot in 2020.
Great.
And it is about grassroots, folks. This isn't about creating a new dynamic. It's about helping with messaging, helping to make sure that science is driving what you say, that the solutions are apparent and we get information out to everybody. But this is one community at a time, one household, one community group, one school, one hospital, one state. This is about going back to what brought us where we got here today, 49 years after the first Earth Day, and got us all this progress. And it's it's grassroots. It's at people talking to other human beings and recognizing that they share the same values and being willing to do something about it.
So there's a lot of people in this room that have a lot of capacity.
You're one of them, actually, I would point out.
Thank you.
You're welcome.
But there's a lot of people that have these very big communications departments there at these hospital institutions, and they, as we've said, they're trusted messengers. And so the idea, I think, of leveraging the communications capacities, the clinical champions, the community benefit funds, there's so many assets that healthcare has to be deployed in this way. And I think one of the hopes that we have is, in addition to the messaging that you'll be providing to folks that could then be replicated all around the country, is that they can do more storytelling themselves about what it's like in their institutions, in their communities, to tell that story, to educate their patients. We just think that it has so much potential to change the narrative in the country. And so I'm hopeful that we can engage people in that storytelling effort over the next year and years, because I think we can change the story about what this is all about.
I really think this can work. It just
needs
a
to work.
core
It has to
message
work.
that we all rally around. I was thinking, I really want a branded message, but just do it has already been taken. So I need to think of something new.
It's close, though.
But it's not bad. It's not bad. It really is about bringing hope back and bringing our values back and not letting anybody take that away from us, because we're better than we're showing right now.
And this group has shown that. I mean, this group is all about solutions.
Yeah.
Like from the very beginning, when we said, okay, medical waste incinerators is a problem, and healthcare is the largest source of dioxide emission, people got engaged and said, I didn't know that. I didn't learn that in medical school. I didn't learn that in nursing school. And 4,500 medical waste incinerators were closed in this country. When people were taught that mercury was damaging the brains of developing children, and there was mercury thermometers breaking and winding up in the environment that was contributing to that, we completely eliminated the market for mercury-based measuring devices in this country and then around the world. Won a treaty. So this is an action group. This isn't a group that's just like, oh my God, the problem is so severe, but they do stuff. And so a lot of what this meeting is about and the work together is about identifying what the challenge is and then actually coming together and together sorting out the solutions. So in that spirit, you have been involved not only around climate and health, but you've spent a lot of your public career addressing the issue of toxic chemicals in people's health.
I've been a little obsessed in all the health.
I've been obsessed with that too. We're both disciples of Ken Geiser at the University of Massachusetts Lowell. So how do you feel like the toxics issue and the climate issue, industrial agriculture, how do those things all weave together?
Well, they all tie together.
I'm throwing you a softball
thank
here.
You. All right. They're all connected by fossil fuels. That's the big issue. And the challenge with the environmental community has always been their pigeonholing. You know, they're all their own little fiefdoms, and we all do that. I mean, because everybody's sort of fighting for a couple of bucks. Do you know what I mean?
I have
so you need
that.
to have uniqueness, and you need to segregate yourself from somebody else, and this is trying to break through that. This is really, I think, needs to be all about how we're connected, not how we're separate, and how we can speak with one voice. And I've been really struggling to figure out how I can change that dynamic, because I want people to be hopeful, and I don't want to always be focused on the bad guy, but the great future. But fossil fuels need to be called out. You know, you have so many people, and you see them all the time, focused on plastics, and they should be. Plastics is a problem. Plastics in the ocean is a big deal. But they've decided they're going to play there and do, you know, look at whether or not they can ban straws, which is still a very good idea to do because it gets people personally engaged. And in the meantime, the fossil fuel companies are paying hundreds of billions of dollars to build new plastics facilities in Louisiana. You know, folks, connect these dots here. You know, of course, you know, pesticides are fossil fuel based. Plastics are fossil fuel based. All the synthetic chemicals that are in your body are fossil fuel based. I didn't mean your suit. It's very, very nice. The jackets are great, and I break.
Thanks.
But where did you get it clean?
No, perchlorethylene.
Oh, I just checking.
Clean.
But there are connect the dots here, and somehow we need to explain to people that we really have a reliance on fossil fuels that underpins a great deal of our economy, and we need to think bigger than straws. And we need to think about a strategy that recognizes that transition is needed and find a way to get really naturally or biologically based substitutes. And when they're available, we need to jump on them and make the creative people who make them available very wealthy.
Yes.
That's my goal, although not me. I have no interest in wealth. That was a joke. I just have no capacity to innovate, so there we go.
No, you're in a good place. So, question is, you know, the health community is getting engaged. The business community is getting engaged in committing to renewable energy and climate solutions. Where young people are getting engaged, where is good climate policy going to come from? Who are the actors? Who are the messengers? What are the building blocks?
Right now, you actually see tremendous opportunity at the city level. Mayors have become the focus of attention. And it makes sense, right? I mean, it's hard to deny the problems that they're seeing that are happening. And it's hard to deny the fact that they need money, usually from the federal government, to support strategies to address the ongoing problems. And so they are seeing, you know, basically with the flooding, you're seeing the inundation of your water and wastewater systems. You can't handle it. In droughts, they can't be delivering the kind of water they need to keep people healthy. And the first person you go to is the one that's closest at hand, whose office you know where it exists. You know, and so they get inundated, and they don't want it. You know, they know the federal government should be stepping up. But right now you have just about 500,000 mayors that have agreed that they're going to abide by the Paris Agreement, and they're developing plans to actually carry that out. and there's going to be a transparency around it so that people are going to have to support it, but also call their bluff if they've made a promise and they can't keep it. Now you're also going to see, you know, states binding together and states working. Republican states are now beginning to do renewable portfolio standards. Some aren't, but many, many are, for the simple reason that it saves money. And they know that consumers want cheaper electricity, and they get the clean part as a bonus, right?
And their jobs.
And you get, so now we are living in the United States when we look to New Mexico and Nevada as clean energy leaders. Who'd have thunk, right?
Nevada.
I mean, seriously, New Mexico.
Yeah.
And so it's really cool to see the shift, and I think that will provide a lot of impetus for on-the-ground work, a lot of emphasis that there are markets for new technologies that are being driven, and you really literally see no change in the move towards clean energy because it's in the market, and we know how energy markets work. It's the cheapest wins.
Right.
And so it's really
wind
cool.
and solar are cheaper installed now than coal and other sources.
But you also, you know, there's interest in one of the things I've begun to do is I do work for a private equity company, just consulting work for them, because they focus on just sustainability and wellness. And I've begun to start talking to investor forums a lot because there is a murmuring there. I can't say it's yet loud enough for my liking, but they're beginning to understand that that people are going to be investing differently and want to invest differently. Part of what you do in this CleanMed organization.
We have a pool on the 4th floor, in fact. You know?
I'm there, baby.
Yeah.
Is basically you try to give people transparency so that people can see where they want to put their money. That's so important, I think, is to wear what you do with pride. Tell people that you've been able to make real progress and that it's great for health, but it's also great for the bottom line. And the more you can advertise that and bring transparency to that and recognition, the more others will follow, because people like to follow winners, not so much losers. And I think we need to bring the same kind of transparency to the investment market. And that's what I've been working with Ceres and others on, is how do you evaluate these investments? Because I know that if my children, you know, they're online all the time purchasing, if I could get Amazon to reduce the size of their cardboard boxes, I would join them. But until they do, I'm not going to buy a key that comes in a 3x3 box.
Right.
Come on.
So, speaking of investments, one of the things that happened in the tobacco effort is that hospitals divested from tobacco companies. And I know there's quite a strong movement afoot to divest from fossil fuels. What do you think about healthcare institutions divesting from fossil fuels? And investing in renewable energy and other clean solutions?
You know, the funny thing about this now is that fossil fuels are not a good investment.
It's a loser, right?
It's a loser.
Coal, you would have lost 75% of your
In the market itself, just looking at it
value.
economically, it's a loser. I think investment firms and brokers need to find a way to make it easier to do this, which they don't for obvious reasons, I think. But we need to start demanding it. I don't know whether it's going to make a difference in who crosses your threshold, but I think it will make a difference in how you feel about yourself and the place where you work. And that's important. I have now recently, I've joined at Harvard. I am now a professor of the practice of public health. 65 I just turned the other day, and I'm still practicing. I find these lingos
It's
very
a lifelong
interesting.
thing.
Apparently.
Practice. That's why we call practice
But
green
I
health.
have just gotten myself into a lot of hot water because I am one of the leaders of a divestment movement at Harvard.
You must
Do you
be
know how much money they invest?
$5 billion.
Well, add a couple of zeros and make it a B, and you got yourself a Harvard investment. They're just, there's huge opportunities for Ivy League schools to step up, as many other universities have, and stop invest. I mean, they stopped investing in tobacco.
Yeah.
And they think that still should give them a pat on the back? I don't think so. Go after what's bothering us now, what's robbing our children of their future. That's what they need to do right now.
Let me ask you a question. What do you think, is nuclear power part of the equation here, or I mean, some people have been saying, yeah, we need nuclear power to be as a transition fuel as we're moving toward renewables. What do you think about that?
This was a conversation that Ernie Moniz, who was the Secretary of Energy, and I, who we like each other very much. His wife is lovely. My husband, he thinks, is great. We just decided not to talk about this anymore. Because, and I'm sure that Ernie, who is a nuclear physicist, I went to a Christmas party with my husband, and they had the 4 prior deans of the MIT nuclear physics department. And my husband was very excited as a florist to entertain himself at that meeting, at that party. He said, do I really have to go? Well, they were fascinated by flowers. Who knew? It was really cool.
Wow.
He was the center of attention.
Wow.
But anyways, having said that, Ernie thinks that there is a new sort of group of reactors that are coming out that will be much more acceptable, much less concern in the part of their need to constantly be cooled. And all that may be right, but I live in my world, which I basically have chaired the low-level radioactive waste management board. I have even chaired the Hazardous Waste Facility Site Safety Council in Massachusetts. I have worked for ages, and I have yet to find a single human being that actually wants to bunk next to a nuclear reactor.
Really?
It just doesn't work.
Yeah.
And so I am not putting my faith in a technology that human beings simply can't get on board with. And there is something about radiation that scares the hell out of people. And there is a gut reaction that you will not get around. And unless you want to tell me that I no longer live in a democracy, but someone's going to dictate this for me, I ain't buying it.
Good. I'm with you on that. So last thing. This audience is the ground troops for the kind of message and strategy that you're promoting. What are your final words to them? What of encouragement, what do you want to say?
Well, Gary, can I start by saying thank you for what you do? And I can remember the early days with you and Bill and others trying to struggle through some of these issues and wondering why we weren't making any progress. And I think that's my main message is that you are making progress. You are leaders that people will listen to. You have stories to tell. We are at a point where I think people are ready to look at the present in the eye and look at the future and get us there. You cannot allow yourself to be discouraged because it takes a lot of work, and some people might not want to hear it. You have to do as we did, which is every day you get up anew and you say, I'm going to do better today than I did yesterday. And if our world and our precious resources and our biodiversity and our kids' future isn't enough to motivate that, then I would suggest you go back to bed and get up again tomorrow and rethink. Because it's worth the fight. We're winning the battle. Do not let anybody tell you differently. Keep going, keep doing what you're doing, and God bless you for what you're doing. Thanks so much.
Thanks. Gina McCarthy.